So one of the entities that I've become increasingly aware of over the last 2 or 3 years is autoimmune pancreatitis. Now, this is an entity that I think most of us as radiologists weren't that aware of as recently as 4 or 5 years ago, and all too often I think we were either missing the diagnosis completely or we were misdiagnosing these patients with run-of-the-mill edematous pancreatitis. Now, these patients can have very, very subtle imaging features on either CT or MRI. But if you know what to look for, I think this is a diagnosis that you can make, and it's a very easy diagnosis to confirm. Many of these patients will have elevated IgG4 levels, and once you've made the diagnosis, they can be very readily treated with a round of steroids. Now, while these patients can have a varying degree of different imaging findings, often they're going to have diffuse enlargement of the pancreas with a so-called sausage appearance as a result of that bulbous appearance of the pancreatic parenchyma, and they'll often demonstrate this low signal intensity or low density rind of soft tissue surrounding the pancreas, which will demonstrate delayed enhancement on either venous or delayed images. So here's a beautiful example on MRI. You can see that the entirety of the pancreas appears enlarged. It has this characteristic sausage-shaped morphology, and there's this low signal intensity rind around the margins of the pancreas, which gradually demonstrates increasing enhancement on the venous and delayed images. This is a characteristic example of autoimmune pancreatitis. This patient had an elevated IgG4 level, and this patient did very well after a round of therapeutic steroids.